அருட்பெருஞ்சோதி திருச்சிற்றம்பலம். எல்லாம் செயல் கூடும் என் ஆனை அம்பலத்தே, எல்லாம் வல்லான் தனையே ஏத்து. இன்று வருமோ நாளைக்கே வருமோ, அல்லது மற்றென்று வருமோ அறியேனெம் கோவே. துன்று மலவெம்மாயை அற்று வெளிக்குள் வெளி கடந்து சும்மாயிருக்கும் சுகம். திருச்சிற்றம்பலம். Good evening to everyone. Today we have our special guest, Madam Archana Gupta. She has done Masters of Audiology and Speech Language Pathology, and she's about to give us a talk on the topic, Need of Early Intervention for Child with Special Needs, Techniques and Strategies Useful at Home for Parents. I would like to invite Dr. Premila Chandrasekaran to brief more about Madam Archana Gupta.
Yes, definitely. It's my privilege. Yeah. Audiology services. First of all, welcome Archana to this.
Thank you, ma'am. Thank you so much.
Compassionate team. It's a compassionate team, and here we introduce various disciplines from the different domains. We introduce therapists. And let me brief about audiology services in education setup and home setup so that people are, இது வந்து இந்த audiologyங்கிறது நம்ம ஸ்பெஷல் எஜுகேஷன் சர்வீசஸ்ல ஒரு முக்கியமான ஒரு பங்கு உருவாக்குறது. அது வந்து பிள்ளைங்க அவங்களோட ஹியரிங் அதை கரெக்டா மெஷர் பண்ணி அவங்க ஹியரிங் எய்ட் கொடுக்கறது, அவங்களுக்கு லாங்குவேஜ்க்கு சப்போர்ட் பண்றது, இது எல்லாமே அவங்களோட மெயின் ரோல். ஸோ த ஆடியாலஜி சர்வீஸ் என்னன்னா அவங்க வந்து இவாலுவேஷன் ஸ்கிரீனிங் ப்ரொவைட் பண்ணுவாங்க ஸ்டூடெண்ட்ஸ்க்கு. அண்ட் இவாலுவேஷன் வந்து எப்படின்னா இன்ஃபென்ட் ஸ்டேஜ்ல இருந்து ப்ரீ ஸ்கூல், தென் செகண்டரி எஜுகேஷன், ஈவன் ஏஜ்ட் geriatric care varaikkum இந்த service வந்து very important. When I worked in my organization as a special education consultant, we always work closely with co-teaching happens in classroom. We closely work with audiologists and speech and language pathologists because on the child behavior, எதனால வந்து autism related conditionல children misbehavior, மேபி த லாங்குவேஜோட அண்டர்ஸ்டாண்டிங் கம்மியா இருந்தாலும் அவங்களுக்கு சரியா கேட்கறது. இப்ப நம்ம வந்து தமிழ்ல பேசுறோம், அர்ச்சனா டசன்ட் அண்டர்ஸ்டாண்ட் தமிழ், அப்ப she is not interested. அப்ப நம்ம என்ன சொல்லுவோம், அந்த லாங்குவேஜ் குழந்தைங்களுக்கு தெரியல அப்படின்னா அந்த குழந்தைக்கு லாங்குவேஜ் தெரியல, நம்ம தெரப்பி கொடுக்கணும். மேபி லாங்குவேஜ் தெரியாமையும் இருக்கலாம், காது கேட்காமையும் இருக்கலாம். ஸோ அதெல்லாம் நம்ம பார்க்கணும். ஒரு குழந்தை வந்து வளரும் போது ஏதோ ஒரு ப்ராப்ளம் பிஹேவியர் படிக்கல அப்படின்னா இது வந்து அவங்களுக்கு வந்து சரியான ஒரு இன்டெலிஜென்ஸ் இல்ல, அப்படிலாம் காரணம் இல்லை. நம்ம we have to rule out, கண்ணு சரியா தெரியுதா, ஏன்னா டிஸ்டன்ஸ் தெரியாம இருக்கும், அதனால அந்த சைல்டு எழுத மாட்டாங்க. இவன் எழுத மாட்டேங்கிறான் அதனால படிக்கல அப்படின்னு வரக்கூடாது. ஸோ சம்திங் we need to rule out all the possibilities, whether the eyesight is good, hearing is good, and only when there is hearing, when there is input, the child will be able to learn and feedback. உள்ளார ஃபீட்பேக் வந்தாதான் அதை ப்ரொடியூஸ் பண்ண முடியும். ஸோ தட்ஸ் வை ஆடியாலஜிஸ்ட் பிளே அ மேஜர் ரோல் இன் எஜுகேட்டிங் சில்ட்ரன். இது மெயினா என்ன தெரியுமா, அவங்க வந்து தே ஃபெசிலிட்டேட் ஆக்சஸ் டு லிஸ்னிங்க்கு அவங்க வந்து என்ன ஆக்சஸ் பண்ணி கொடுப்பாங்க, லேர்னிங் அண்ட் கம்யூனிகேஷன். இது மூணும் தான் அவங்களோட மேஜர் ஏரியா ஆஃப் ஹெல்பிங் எஜுகேட்டர்ஸ் அண்ட் அதர் தெரபிஸ்ட் எல்லாரும். இப்ப இதுல என்னென்ன பண்ணுவாங்க, வாட் கேன் அன் ஆடியாலஜிஸ்ட் டூ ஃபார் யூ, எப்படி அவங்க நமக்கு யூஸ்ஃபுல்லா இருப்பாங்க அப்படின்னா, அசிஸ்ட் வித் ஹியரிங் ஸ்கிரீனிங். இப்ப கரெக்டான ஹியரிங் எந்த நேரத்துல அவங்களுக்கு கேட்கும் கேட்காது, எவ்வளவு அவங்களால கேட்க முடியும், கேட்கிற திறன் எவ்வளவு இருக்கு அப்படிங்கிறத ஸ்கிரீனிங். நோ அசிஸ்ட் வித் ஹியரிங் ஸ்கிரீனிங். ஏதோ ஈவன் வந்து ஒரு சைல்டா வந்து உட்கார மாட்டாங்க, அவங்கள்ட்ட கண்டுபிடிக்கிறது கஷ்டம்னாலும் இவங்க வந்து டெக்னிக்ஸ் யூஸ் பண்ணி கரெக்டான ஸ்கிரீனிங் கொடுப்பாங்க. தென் ஆடியோலஜிக்கல் இவாலுவேஷன், அவங்களோட லிசனிங் டிவைசஸ் இருக்குங்களா, அது கரெக்டா ஃபங்க்ஷன் பண்றது. காதுல ஹியரிங் எய்டு போடுவாங்க, அதுல மோல்டு இருக்கும், அதெல்லாம் கரெக்டா ஃபிட் பண்றது. ஐடென்டிஃபை மெடிக்கல், ஏதாச்சும் வந்து மெடிக்கல், நாங்க வந்து ரீஹாபிலிட்டேஷன் ப்ரொஃபஷனல்ஸ், வி சென்ட் தி சைல்ட் இஸ் நாட் லிசனிங், கேன் யூ செக்? அப்போ தே வில் செக் த ஹியரிங் அவங்களுக்கு கரெக்டா இருக்கா. நான் ஐ ரெஃபர் மை ஸ்டூடெண்ட் டு an audiologist. Kindly check the hearing loss, it's there, can you check? So she checks, and then along with a special educator, we work as a transdisciplinary team, and special educators are into education, so along with us they also work, and then we work as co-teaching we do in classrooms, and then we produce good positive outcomes to students. Then collaborate with outside agencies, and also classroom, they come and observe the child in the classroom. It is not only the teacher, the audiologist also, they find where the child lags, which sound, which ear, the right ear or left ear, all that they will take care, and also determine for the additional, any additional educational accommodations are required, or any hearing assistive devices are required. All that recommendations will be provided by audiologist. Then take ear impressions and order. இயர் நம்ம காதோட அளவு அதெல்லாம் பார்த்து அதை உள்ளார எப்படி கொண்டு போறது அதெல்லாமே அவங்க பார்த்துக்காங்க. கரெக்டானபடி ஃபிட் ஆனாதான் ப்ராப்பரா காதுக்குள்ளார கேட்கும். அண்ட் ப்ரொவைட் ட்ரைனிங் ரிகார்டிங் இம்ப்ளிகேஷன்ஸ், எப்படி அந்த ஹியரிங் எய்டை எப்படி யூஸ் பண்றது, அதனால சவுண்டு வருமா, இப்படி எப்படி வைக்கணும், பேரண்ட்ஸ் எப்படி ஹேண்டில் பண்ணணும், அந்த இதெல்லாமே அவங்க வந்து ஹியரிங் எய்டை பத்தி அவங்களுக்கு சப்போர்ட் பண்ணுவாங்க. அப்புறம் அந்த செல்ஃப் அட்வொகசி, தே ஆல்சோ டிஸ்கஸ் செல்ஃப் அட்வொகசி ஸ்கில்ஸ் வித் ஸ்டூடெண்ட்ஸ், ஹவு யூ கேன் மேனேஜ். It is not that always you need help from others. How you can handle your hearing aid, அதெல்லாம் வந்து அதையும் அவங்க டீச் பண்ணுவாங்க. Then IEP meetings, whenever we conduct IEP meetings and case conferences, they play a major role, and they also provide their intervention, and then we combine that and create it as an individualized education plan. Then they also assist in transition from birth to adult, school age to high school, from high school to other, then from training to employment, then home, livelihood, for all across age group. In the transition plan, they also play a major role. Now over to Archana. She is an amazing and positive energy filled professional, and we are so happy to have you on board with us, Archana Gupta, and please, you can.
Thank you so much, ma'am, for such an amazing introduction.
With your expertise.
So I think a lot of points you have already mentioned, but yeah, I'll be talking about all these things in detail, not that much, but relevant to today's title. So I have to share once.
Yeah, share screen.
Yes. Okay, firstly, a very, is it visible?
Yeah, it's visible, Archana.
Okay, so firstly, I would just like to welcome everyone. Very good evening to one and all. My introduction, I'll start with that. I'm Archana. I'm an audiologist and speech language pathologist. I've done masters from Ali Avarjam National Institute for Speech and Hearing Disability, and this year I enrolled myself for PhD program, and I'm working as assistant professor at SJT University, which is in Gurugram, Delhi, NCR. So the topic that I'll be talking today is need of early intervention for child with special needs and techniques and strategies useful at home for parents. So before coming to this topic, let's just understand who an ASLP is, who's an audiologist, who's a speech language pathologist, and what are their roles. So firstly, we just deal with speech and hearing disability present at birth or acquired at any age, whether it's adulthood or even at geriatric or it's the early adolescence age, any age group, if anyone is having speech and hearing disability, they have to consult an audiologist or a speech language pathologist. Different speech disorders comes under our profession that we have to deal with, like stuttering, stammering, misarticulation, voice problem. And we have motor speech disorders, we have language deficient disorders, we have aphasia, we have dysarthria, we have dysphasia. Then a lot of patients come after their surgeries, like they have vocal nodules, the surgery has been conducted, and after that they're coming to us. So we have to deal with the voice aspect. And same, we are dealing with the audiology part as well. So in audiology, a person who is born deaf or who's having hard of hearing, what is the habilitation we have to do, what is the treatment plan, and what is the management, and what is the team approach for a positive outcome and for a successful life of that child. So we have to deal with the oral rehabilitation, that is first hearing aids, and secondly, which is cochlear implant. So we deal with these three things. And now coming to the topic of the day, that early intervention. So by early intervention, we simply mean that starting the intervention plan or starting the treatment plan as early as possible. Now the question arises that why we are emphasizing that it needs to be started early. Why not any time of the life of a child? So there are some few points which I would like to mention in this, and it is that a child, when it is born, the age period till 3 years of age is known as critical age period. Till 3 years of age, the brain development takes place. And once the brain has been developed completely, in which the medical term is neuroplasticity, once it's done, the acquisition of the language is very, very difficult. And imagine a child who is born with hearing loss. If the child is unable to hear till 3 years of age, how can we expect that child language and speech will develop age appropriately? No, it will not develop age appropriately. Then a role comes in. We have to deal with the evaluation process. We have to deal with the treatment plans. We have to see if the child is having any other associated problems or not. The child can be simply delayed in speech and language pathology, or it can be a delayed in speech and language pathology with ID, intellectual disability, or it can be with along with cerebral palsy cases. The child might have behavioral issues like autism spectrum disorders. There can be a lot of different associated problems, and accordingly the treatment plans evolves. Now coming to another very important aspect that I have to emphasize upon is this. Can you all see this screen? Ma'am, is the screen
Yes,
visible?
yes, I can see it.
Okay. So till the child is 5 years of age, the child follows a milestone. There is a speech and language milestone which takes place till the 5 years of age and even after that. So being a parent of a child with special needs, you need to have an idea, you need to have a monitoring of these milestones. If the child is able to acquire these milestones age appropriately, then there is no need for any kind of speech therapy. But if the child is not able to acquire these skills age appropriately, then there is a high risk that the child will develop a delayed in speech and language and might be difficult in their future to deal with communication. So as we can see in the small picture, there are different bubbles. So these are the language milestones. So at 3 months, they are telling the cooing and gurgling is developed. So cooing and gurgling are simply the vocalization. When the child is trying to speak, it's only the sounds, no syllables, no words, no meaning, nothing. It's just the sounds. So at 3 months, this takes place. 6 months, the babbling occurs. So babbling is something repetitive utterance of monosyllabic words. So what do we understand by monosyllabic words? Like if the child is saying ba, so the child will say ba 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 pa 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 pa. So this is babbling, continuous repetition of a single syllabic word. Then at the age of 12 months, the first true word will be achieved by the child. The first true word means that the word will have a meaning and the child will speak that word knowing that what the word is about. It will not be simply just speaking that word. Suppose the word can be ma or the word can be pa. The word can be ma or papa. It can be anything. So it's not that the child has to say ma and we are assuming that it's a true word. No, the child has to say ma looking at the mother, and the child should be saying ma only when the mother comes. If he or she is telling ma anywhere, anytime to anyone, then that is not recognized as a true word. So we need to be very much sure that what is the first true meaningful word acquired at 1 year of age by the child. Now coming to 18 months, almost 1.5 years, by this age, they know around 5 to 40 words. Now these words can be words which comes in their daily life, like name of any toy, any food items, basic things that they hear all the time, maybe the names of the family members. So by 1.5 years of age, the child should have minimum of 5 and maximum of 40 vocabulary. Now coming to 2 years, this increased to 150 to 300 and the phrase level is achieved at 2 years of age. So what is a phrase level? Phrase and sentences are two different things. In phrase level, they are not aware about the prepositions. They are not aware about the grammar. They are not aware about the present tense or future tense or the past tense. If the child simply wants water, the child might say, Mama, water. Or the child might say, Mama, food. But when the sentence will be achieved, it will be different. It will be like that the child is telling, Mama, I want food. That is one full sentence. Now, coming to 3 years of age, this will come to 900 to 1000 words, and the child will start asking short questions. The short questions will be it will be more interesting or the child will show more excitement to know what is happening around him or her. Like if any movie is going on, if a song is getting played, or they're going anywhere out, so they'll be like, where are we going, what are we doing, what are we wearing, why this, why that. A lot of questions will start coming up. So this will attain at 3 years of age. Now at 4, here it will be sentence level, which will have like 5 words. The sentence will comprise of 5 words and it will be a kind of better than phrase level, but still not a complex sentence will be achieved. But at 5 years, the full complex sentence will be achieved by the child. They know what is a letter, they know what is the alphabet, they know how the words, they know how grammars are going, what is present tense, what is future tense, what is past tense, how they have to use the prepositions, what is the verb, everything they will know. And at 5 years of age, they can have at least 2 or 3 language acquired by themselves. If suppose the mother tongue is Tamil, exposure is to English. And if the child is staying outside somewhere in Europe, so the child, if is having a hearing loss, it's not having a hearing loss, the 3 of the language can be acquired by the child. And it is a proven theory given by scientists. And it is known as 3D lat. What they tell in this, that if the neuroplasticity is done age appropriately, if the exposure is very good, if the child is not having hearing loss, then the child is likely to acquire minimum of 3 language by the age of 5 years. And this is the normal development milestones of speech. And being a parent, it's very important to have a monitoring of these milestones at home. And this can only be done by parents. Clinicians or therapists cannot have all the time, when they just have hardly a 45 minutes therapy sessions with the child. They cannot sit the whole day, but the parents are the one who have to sit the whole day. They are spending more time, so they have to monitor all these things daily basis. So if they come across, like, if any of the milestone if not achieved by the child, they must refer a speech language pathologist. Now, coming to some tips and strategies that a parent can themselves, being at home, can focus upon. So the first is that, yeah, they have to focus on the communication and not just word. It's the communication that needs to be acquired, not words. Like, we know the lexical items around, we know a lot of things, the vocabulary of fruits, vegetables, clothes, color, shape, season, weather, everything. But that is not enough. They should know how to communicate. More communication strategies needs to be attained by the parents. If the child is sitting and having a mango, you have to tell the child, that this is a mango. But at the same time, you need to make the child understand the mango is sweet, the mango is sour, or the mango is in yellow color, or the mango is a fruit, or mango is not a vegetable. So these kind of additional informations needs to be given by the parents to the child, so that they are more focusing on the communication skills. Now, coming to the next point, they're telling use meaningful and functional vocabulary. Now, what is functional vocabulary? As I just mentioned in the previous example, the sentence, the communication has to be meaningful, but at the same time, it needs to be functional. If suppose the child is having a red ball, okay, we have to tell, okay, this is red in color, this is the ball, we play with the ball. But if you're telling the child, after playing bat and ball, keep the ball in that box and keep the bat under the table. So the understanding of these concepts, that how do we have to do the actions, this is also very, very, very important, because we are just telling them, but what they are understanding, what they're doing, when they're understanding what we're doing, it's the development of the language. We simply tell that, just keep it under the table or just keep it in the box. But the difference between under the table, in the box, this strategies, these ideas, this needs to be get developed in the child's brain, in the Broca's area, in the Wernicke's area. And how do we attain it? We attain it by using in daily examples. Very simple examples. We might not even think about it at some times, but it's very, very useful. Now, coming to the next one, it's to be very kind and patient. We cannot expect the child to learn everything in one day. That is not possible. If the child is having a delayed, if the child is having a hearing loss and you have started with the speech therapy sessions, you cannot expect that the child would start speaking within just 2 sessions, or within just 1 month, or within just 1 year. No, you cannot. We need to be patient. Every child is different. Their special needs are different. Their IQ is different. The kind of exposure they are getting is different. The therapist is different. The kind of cooperation they are getting from the parent side is different. The attention that they're getting is different. If they're having sibling, the attention is getting separated, or if they're a single child, they're getting more pampered. So a lot of things plays a very important role in the development. So it needs to be very important. Parents need to have patience. They should understand that it's not a one-day task that, the therapies have started and, the kid will start speaking. No, that will not happen. Now, coming to the next point is to play together. Yeah, I mean, in speech therapy, what we actually do, one might perceive it's just the play session going on. The therapist is playing or the child is playing, but there is a whole techniques and strategies behind it. It's just not a play session. The play session is with the techniques, intentional techniques and strategies, so that the target word of that session is achieved by the child. So the parents, after they take the child from the therapy to the home, it's very important to continue that play activity with the child. It's not that in 45 minutes the therapist have taught and it's done. No, that will never happen. The parents need to repeat it all over again, do the generalization in the 24/7 routine so that the child remembers, learns it when they come next for the therapy sessions. That comes to my next point, that is repeating. Yes, it's very important to repeat what you have already taught. Like if you have taught one thing a week ago and then you're working upon something else in the next week, no, it's not always necessary. The child will remember ki, I was taught that thing in that day on that time, and right now I'm being taught something else. No, there might be chances the child has completely forgot. So it's very important to have a revision, to have a repeat of everything that what you're taught teaching to the child. Now next is to the wait. You have to wait for the response. If you're telling your child that this is a fruit, or this is a vegetable, or this is a pink color, or this is a blue color, anything like that, the child needs time to process it in the brain. Anyhow, the critical period has been lost. Anyhow, the acquisition of the sound has not attained till 3 years of age or 2 years of age. So you need to be very patient and you need to wait for the response. The child will not say that it's a blue color, because when the child is telling it's a blue color, it's not blue. The child should be able to phonate b, l, and oo sounds. This phonation of these sounds, the blending of these sounds, which comes out to be a word, and then understanding that what blue is actually, it's a color category. It's not a fruit category, it's not a season category. So this understanding is also very important. Now next is you imitate them. Why do we have to imitate them? Because imitation skills plays a very important role. Like if at all I'm doing some activity and the child starts imitating me, so there's a possibility that what I'm doing, the child is also doing, and the child is learning the same behavior. That's why we say at times, don't do wrong activities in front of kids, because they will learn, because they have the tendency to imitate things and learn things. But we try to do it when we are concerned about bad behaviors. But the same approach we can use in speech therapy to make them learn the positive outcome. Like if I have to make them understand a concept of something, I'll also do the same thing. The child will start imitating me. So they are learning something good from me. So the imitation skills is also very, very important. And you have to create the opportunities to talk. This is a very important point, because what happens at times in today's world when both the parents are working, like in COVID scenario, working from home scenarios were there, they don't have time to talk with the child. They are busy with the laptops daily in front of the screen, and child is all alone. They have no one to talk. If the child is the only child, no parents, no grandparents, no siblings, no friends, then how can we expect the child will have a normal speech language development? No, they will not have. So we need to create opportunities to talk. Take out some time for your child. Sit with them, ask them, what did you do? How was your day? If not that, just try to speak with them in the whichever language age they are. If they're on word level, try to talk in word level. If they're on phrase level, try to talk on phrase level. If they're on sentence level, try to talk on sentence level. But create opportunities to talk so that they have someone to talk with. And last but not the least is model what you want them to say. This point is very much similar to imitation skills. Yes, if I want the child to learn the word cat, so what I will do, I'll start imitating, I'll start modeling as if I am cuddling a cat. And I'll try to include the word cat, 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 cat all the time. The cat is very cute. The cat is very furry. The cat is very witty. The cat is smelly. The cat is very soft. The cat is biting, anything like that. You need to put in that target word again and again in your conversation, in your speech, so that the child is able to understand, okay, the mother or the father is doing something with the cat. Who is a cat? This is a cat. So that acceptance of the things, comprehension of the things takes place in a better way. With this, there's one more very important thing that I would like to share is like, in this COVID scenario, 2019, 20, and 21, like in our clinics, in our hospital, we see a lot of cases like the child is born in 2018 and 19 with normal hearing, but due to this COVID, the complete lockdown scenario, the parents were working from home. They don't have grandparents, they don't have siblings, they don't have friends, they have no one to talk with. They don't have animals, they don't have pets, nothing is there. Those child is, they are having this behavioral issue. A lot of cases are coming up who are born in 2018 and 19 and 2021. They are diagnosed with autism, they are diagnosed with behavioral issue. Why it's happening? Because in the critical age period, that was the growth period. 2018, if the child was born, 19, 20, and 21, this is the growing period. In this period, the child is having no one to talk with. The kind of exposure that he's getting is zero. He prefers to be in aloofness. He prefers not to talk with anyone. He just wants to be by himself. They're getting more adapt to gadgets, mobiles, into screens. They don't know the real world. They're into virtual worlds. Literally, patients are coming and they're telling that my child experienced walking on the grass for the first time in 2021. And I was amazed to even hear this. They are telling they don't have friends. The child is not even, going out to play in the evening. They're not riding bicycles. Because of this, a lot of even developmental milestones, they are not getting achieved. Restrictions of the physical activity, restrictions of any activities, which involves the friends or the peers, it's getting restricted due to COVID, due to the lockdown. And they are at high risk and they are likely to develop these behavioral issues in spite of having intact hearing. So it's very, very important not only for the parents with having children with special needs to be more focused on these points, but even for the parents who's having child and the child is having normal hearing. Because a scenario, we don't know what might happen in future, and the already 2 years have been in home for most of us, like for all of us in fact. So it's very, very important to be very much focused on these points at least. And whenever you are seeing the child is not attaining any milestone, please refer a SLP at the earliest, because they are the one who can guide you, who can give you home therapy plans for your child. And if anything's come across which you can't deal with, they can always and always guide you. And ultimately, this 5 years of age will decide the future of the child. So this was the presentation. So if anything, I think now the session is open for discussion. If anyone wants to ask anything.
That was a wonderful presentation, Archana. Thank you. And you have really cited what we have to do at the home, and especially the parents on all the strategies of imitation, everything. Wonderful.
Thank you,
To
ma'am.
parents, if any questions, kindly you can ask.
Madam Archana,
Yes, ma'am.
it was a wonderful topic, very informative. Even
Thank
though
you,
you have, you are traveling far in this field, but you had given the very basic informations that the parents need to know, because parents always they don't want to think the first step first. They always think of the last 10 steps. How are they going to bring their child? But what are the what is the first thing that they have to do is, they don't have to teach their kids the bombastic words, just simple words that they need to, they need to start communicate with their kids. That's the basic thing, because when they start with that step, then only they will know what is the next and the next steps that they will get to know by themselves by they are starting with this first step. So I hope all the parents they benefited out of this information that you had given. Thank you very much.
Any parents, please ask your questions, because this is the right opportunity. Anything home front, if you face any communication difficulties or you have difficulty to communicate, you don't know why the child is crying, why the child is not listening, please ask your questions.
So my name is Lakshmi Narayana. I'm actually from USA. Okay.
Right.
Thank you, Archana. It's a wonderful presentation. Pramilaji, your initial opening and also the coordination is excellent. Actually,
thank you.
I am a parent of a autistic son. Okay, and he's into his teen years now. So he's 21 now. Okay, so the early diagnosis happened at around 5 years old. Okay, and since then, either through the school or other services, we've been, managing, and then proper IEP goals were set and everything. Everything went well, and he did pass his high school and everything. After that, suddenly, he completely